Rob Shapiro from Technique Peak. Here we're going to look at a different area. We're going to look at costosternal. And we need that mobility. We always think of getting the mobility of the thoracic spine. We think of the posterior part. We mobilize the joints. But we have to remember that the joint's in the front. What you can do is you can go next to costosternal, go in and see as you push down, does it have a good spring to it? Justin's pretty good. A little bit of tightness through there, right? But they do it pretty well. Again, obviously be aware of where you're poking and ask your patient for permission. As you go through there, I'm finding it's a little bit stiff in this area. So I could use a reflex technique, which is kind of an interesting way. So I could use the serratus on one side and the lat on the other to activate and contract. It's like a recoil technique, which works on like type 3 receptors that once you activate a muscle quickly and relax it, you'll decrease the tone of the tissue around it. Now, it doesn't matter. We're going to do both ways. So if I want to get this arm up, okay, and this arm. So this arm I'm going to use this lat. I'm going to say, Justin, I'm going to try to push you out. This arm I'm going to use this serratus. So it's going to take the ribs and it's going to do that to it. So don't cheat. Don't look. As I move your hand out and up, you stop me. Right? Wherever you feel it. Good. And as quick as you can. I forgot I'm working with a martial arts person, so I might get hurt. Hold it right there. Ah, good. Ah, you missed it. Good. So now he's using his reflexes. This is right up your alley. Okay, and this arm, now I could do the same thing. I do both sides. Again, this side I'm using serratus. This side I'm using lats. So the same thing on this side. Don't let me pull this arm out and don't let me push this arm down. When you feel it, hold it. Good. And it's all about reflexes. You don't tell him when it's coming, right, and let him do it. And automatically, it's kind of an interesting technique. There's a recoil, the tissue will contract, relax. You'll come back in, and then you'll see, which is actually pretty good for you. You get more mobility in that area. Pretty good there, but he had his tough area through there. Again, watch your patients. Obviously, have some pathology of the shoulder. You have to be aware of who your patient is. Kind of a cool reflex-based technique or a recoil type technique to decrease or increase the mobility in the costosternal joint. Rob Shapiro from Technique Peak.